If you're turning 65, that means it's time to enroll in Medicare. However, enrollment isn't always easy. Here to ease us into the deadlines and details is Matt Tucker. Matt is the president of TruBridge, a company that specializes in Medicare education. Sounds like a very needed service.
Very, very needed.
So let's talk about deadlines and turning 65. So it can be more expensive if you don't pay attention to what's going on with Medicare and what you have to do.
No, absolutely it can. I mean, the good news about it is that Medicare, generally, you're automatically enrolled in A and B 3 months before turning 65, or if you've been on disability for 24 months. So a lot of people are automatically enrolled. The deadlines that they're concerned about are making sure during that initial enrollment period that they choose the right Medicare or prescription plan that works for them, that meets all their needs. You know, one penalty or concern that people have is around prescription drug coverage. There are penalties that come into play if you don't choose a plan within the required time frame.
Okay, so we're showing now on screen some of the time deadlines there. So tell us about those.
Sure. So from the time you, from 3 months prior to turning 65, the month of your birthday, and then 3 months after, you have the ability to enroll in a Medicare plan, a Medicare Advantage or a Medicare Part D plan, or you have guaranteed acceptance in a Medicare supplement plan. So it really depends on, as you can tell, there's a lot of options for people. This is their window to really get into the Medicare plan and choose the right coverage for them.
Okay. Well, you talked about A and B and C and D. That's confusing in and of itself, besides right around your birthday deadline. So tell us what all of those mean.
Sure. Well, Medicare Part A is generally around inpatient hospitalization. It does include some hospice or home health care coverage. Medicare Part B is really for outpatient services like doctor visits, x-rays, lab work, durable medical equipment. So those are the first
That's
two.
your main health insurance.
Yes.
So, and on that screen it said you have to have A and B before you can get C, and you have to have A or B before you can get D. So let's talk about C and D.
Okay. So Medicare Part C, most people would know that as a Medicare Advantage plan, and you know, it could be an HMO, PPO, fee-for-service plan. You have to have A and B, and that's basically represented by private insurance companies who are managing your health care. Medicare Part D is specific to the prescription drug benefit, and some Medicare Part C plans can have D coverage in them, and you can also just buy a prescription drug plan by itself.
Okay, so if you've got all these plans going, it sounds like it could get expensive. Is there some help for that?
There is. I mean, obviously the first thing is making sure you do a needs analysis and find the best plan that fits your situation. But let's say you had some income issues. Obviously when we retire, our incomes are generally lower. If you meet certain income requirements, you may get assistance from Medicaid, or you may qualify for low-income subsidy, which helps with your prescription co-pays or monthly expense.
Okay, it sounds like though you've got a lot of options and you really need some help.
It would be highly recommended. It's very confusing. There's a lot of plan options. Like I said, you have Medicare supplements, Medicare Advantage plans, Part D plans, and then there's many options within those categories. So what we try to do at TruBridge is just do a needs analysis and walk people through what fits their situation and what's important to them.
Perfect. So now is the time to investigate your options. To learn more, use the information that's coming up next. My thanks to Matt Tucker for joining us today.
Thank you.
For more information, call TruBridge at 855-663-5593 or click to www.trubridgeit.com.